Ladies and gentlemen, today I'm going to speak about diabetes in pregnancy and its relation to fast Ramadan or not. Diabetes in pregnancy, either you are a well-known diabetic lady and you are already on treatment, or you are not a diabetic lady, but you developed the diabetic symptoms during pregnancy. Oh, how it comes? That's your questions. If I'm not diabetic, can I be a diabetic during pregnancy? Yes. Why? Number one, the hormones of the pregnancy, it act as anti-insulin. And that is the reason why you develop a diabetes in pregnancy. Is it for all of us? No. It depends about the function of your pancreas. If your pancreas is producing enough amount of insulin and functioning very well, you will not develop additional diabetes. But if your pancreas is working just on the borderline, I mean producing just enough amount, and with the effect of the hormones of the pregnancy, which work as anti-insulin, of course you will develop the sign and symptoms of diabetes in pregnancy. How can we discover it, doctor? It's quite easy. For all of yours, for all of the pregnant ladies, first of all from the history, if your mother is diabetic or close relatives are diabetic, or if you have developed gestational diabetes on the previous pregnancy, or you have been under the effect of some medicine which making an stress on the pancreas, or you have had big babies over 4 kilo or 4.5 kilo in the previous pregnancy, all of that suggests that you should be investigated before you get pregnant. And to make a cortisone stress test to see if you will be one of that ladies who is going to develop diabetes with pregnancy or not. Doctor, I am already pregnant and I have no symptoms or signs of diabetes. How can I know that I'm going to develop it or not? Oh, that's a good question. At the booking clinic, regular antenatal care, early booking with your doctor for antenatal care, then we do fasting and postprandial blood sugar at the booking clinic, and if it is normal, we check the urine every time you go to your antenatal clinic consultations, and if there is no sugar, we can wait until 28 weeks, and at 28 weeks we can repeat the fasting blood sugar and the postprandial blood sugar, and we may need to do the glucose tolerance test. Just in case, if the results are an abnormal test, we have to check the blood sugar 5 times a day before we control the blood sugar. What do you mean 5 times? This means we have to do the blood test fasting, blood sugar, then 2 hours after breakfast, then pre-lunch, pre-supper, then at midnight. Why? Because blood sugar has to be controlled all the day through, not only for a few hours. And when we do that source of test, we will know actually what source of treatment do you need. First of all, oral treatment, I mean treatment by mouth for pregnant ladies, it is forbidden. Even if you are taking oral treatment for the diabetes when you were not pregnant, we are going to change it to be an insulin. Because with the pregnancy, with the hormones of the pregnancy, it will not be effective. And at the same time, oral anti-diabetic treatment, there is some query remark about teratogenicity. It may cause an abnormal baby. Diabetes has to be very well controlled because there is high incidence of abortion with diabetes. And that is the reason we say we have to control the blood sugar level all the day through. This means we have to control the blood sugar level through long-acting insulin and short-acting insulin. Combination between both, this means you have, after you take the injection, you have to eat. Situation like that, do you think that you will be able to fast? If you decide to fast, you are planning for a lot and a lot and a lot of trouble for yourself and your baby. What do you mean by that? Moderate to severe degree of diabetes mellitus, you may have a big baby, which you may have an obstructed labor or difficult labor later on. But mild degree of gestational diabetes, which controlled only by diet, and that's a lot of cases, just like that, no need for any treatment at all, except to put you in 1,000 calorie diet or 1,200 according to your weight and according to the blood test. Situation like that, you may be able, and maybe fasting itself, it is a treatment for you. Okay? This means we have two types of diabetes. One of them, you may be able to fast through if the diabetes is going to be controlled only by diet, which is the mild degree of diabetes. The other one, either you are clinically diabetic or you develop diabetes during pregnancy but in moderate or severe degree situation when you need to take short-acting insulin and long-acting insulin, situation like that, I don't think that you will be able to fast Ramadan. And that is the reason it will be a doctor decision, it is not your decision. Okay. What is the complication of the diabetes? Complication of the diabetes mellitus, you might have high incidence of abortion, and that is the reason why you have to control diabetes mellitus early in pregnancy. High incidence of congenital abnormality, you may have an abnormal baby, controlling of diabetes reduce that. High incidence of preterm labor, control of diabetes, it will help preventing premature labor. And big babies and obstructed labor and high incidence of cesarean section, control of diabetes will help you to have a normal delivery. And high incidence of high blood pressure or pre-eclamptic toxemia with pregnancy, control of diabetes, it will help to prevent the high blood pressure. And at the same time, high blood pressure with pregnancy, it may affect your kidney function or your hepatic function. And control of the diabetes and making very close antenatal care visits to your doctor, it will help to prevent all of that, and he will give you the advice regarding either to carry on fasting if the control of the diabetes only by diet or mild degree of diabetes. Number two, it may tell you, no madam, don't fast Ramadan because you are going to have many injections during a day, and after injection you have to eat, because if you take the injection and you don't eat, maybe you will develop low blood sugar